video provided by Harris Health, an 11-month-old little girl is put on a medical transport chopper this morning and sent to a hospital in Temple, 150 miles away, because there were no pediatric intensive care beds available for her right here in Houston.
We actually initiated a transfer request to a facility with a higher level of care for pediatric patients, and we were unable to identify a facility in Houston.
Patricia Darnauer of LBJ Hospital says her staff called all 5 major pediatric hospital systems in the greater Houston area, and none would take a transfer patient. Well, that doesn't mean there are literally 0 beds. It's clear that the COVID-19 surge is straining resources.
I don't have the details for each facility. I'm sure each of them does have their own criteria for when they would accept or deny a patient.
An 11-month-old girl battling the coronavirus is doing much better one day after she had to be airlifted from Houston all the way to Temple, Texas. The reason for that? There's a shortage of pediatric ICU beds across the Houston area. A spokesperson with the Harris Health System says none of the major pediatric hospitals has available beds. Yesterday, little Ava Rivera was intubated, but we're told that her condition has greatly improved, and doctors do believe that she's on her way back to full health.
Here are the many factors that's contributing to the pediatric bed shortage. First and foremost, the COVID-19 Delta variant putting more kids in hospitals. In addition, we're seeing an increase, doctors say, of respiratory syncytial virus or RSV. There's also typical summer childhood injuries like falling off a bike and breaking an arm or a leg, and also back to school health checks. While every child's situation is different, for today, it meant that an 11-month-old little girl is getting her COVID treatment 150 miles away.
Now we just have many patients every day. We are back and beyond our pre-pandemic volumes in the emergency center here at LBJ.
COVID cases among young children are almost doubling in some parts of Texas. Good evening. Thanks for joining us here at 11:37. I'm Robert Hadlock.
And I'm Britt Marino. Some pediatricians tell us their hospitals are near or at capacity. One baby infected with COVID was airlifted to a hospital about 170 miles away because there wasn't enough space in the Houston area. KXAN's Jennifer Sanders takes a closer look at what we are seeing in our area and across the state.
She's doing much better. She's off the breathing machine right now. She's stable, and I saw her about 2 hours ago. She's resting in her mother's arms comfortably.
11-month-old Ava Ramirez started her journey from Houston to Baylor Scott and White McLane Children's Medical Center in Temple about 24 hours ago. This after being diagnosed with COVID-19 and airlifted because there were no available beds at major pediatric hospitals in her area.
Certainly scary for her parents. She arrived at a hospital in Houston where, because of her condition, they needed to put her on a breathing machine.
Dr. Dominic Lucia is treating Ava. He says hospital capacity is a concern statewide as they see more respiratory illnesses among children.
We've seen all children's hospitals across the state near at capacity, including ourselves.
Community pediatrician Sunena Suha went from seeing about 5 to 10 COVID patients a day to more than 20 at Austin Regional Clinic. For kids under 12, she says symptoms may vary.
I'm still seeing milder, cough, congestion symptoms, watery eyes, scratchy throat, that kind of thing. But there are always cases that could fall into that 2% that tend to be more significant.
Travis County is seeing an uptick in cases among children under 10. Data from Austin Public Health shows last Friday there were about 35 new cases in that age group. This Thursday, that number was almost doubled.
In terms of the severity of disease, the portion of those kids who are getting severely ill is still the same, but that number is higher because more kids are sick.
That's why this fall will look a lot different for Erin Hazel and her 21-month-old son.
We decided not to put him in daycare because of the Delta variant. So we're pretty much going back to previous pandemic precautions.
In Austin, Jennifer Sanders, KXAN News.
Doctors stress COVID-19 protocols are still important for families with unvaccinated children, especially ahead of the start of school. We also checked in today with Dell Children's Medical Center to see how many COVID pediatric cases they have and how many beds are available. We'll let you know when we hear back.
Across Texas, more than half of people ages 12 and older are fully vaccinated. But where do vaccination rates stand for the youngest Texans who are eligible? This graph really breaks it down and shows you ages 12 to 15 here. In Texas, nearly 26% are fully vaccinated. But in Travis County, that number is much higher. 42% of children in that age group are fully vaccinated.
Health officials say emergency authorization for COVID vaccines in children under the age of 12 could come this winter. Vaccine studies for that age group are happening right now. Pfizer, which is the only vaccine available for those ages 12 to 15, expects data on children ages 5 to 11 in September. Trial results on toddlers up to age 4 could come soon after that. Moderna's timeline for data on children is likely later this fall or in early winter.
And speaking of that state, health officials are warning Texas is experiencing the steepest rise in COVID-19 hospitalizations since the pandemic began. The surge is placing a big strain on the Texas healthcare system, with hospitals now dealing with a staffing crisis. Here's one example quoted by the Texas Tribune, quote, Texas nurse Jenna Price gets half a dozen solicitations a day from hospitals and staffing agencies that want to pay her 4 times her current salary to leave her job at a suburban Central Texas emergency room and take a temporary assignment in another hospital that needs nurses. The COVID burnout is causing nurses of all specialties to leave the profession in droves. There currently are 23,000 more unfilled jobs in Texas for registered nurses than there are nurses looking to fill them. Let's bring in Dr. Ismail Porsa. He is president and CEO of Harris Health System, located in southeastern Texas, which includes the city of Houston. Dr. Porsa, thank you so much for being with us this morning. Just give us a snapshot of what's happening inside your hospital right now. How many cases are you seeing, hospitalizations, and how different is that from just, say, a few weeks ago?
Good morning. Thank you for having me. Let me start, as always, by thanking all our healthcare staff, doctors, nurses, specifically in my system, Harris Health System, who's been dealing with this pandemic for now more than a year and a half, and also all healthcare staff here in Harris County and state of Texas and in the U.S. and actually everywhere. To answer your specific question, the numbers are going up. The numbers are going up rapidly. The point that I made not long ago was the fact that it's not so much that the numbers are going up, the rate at which the numbers are going up is unprecedented. This is now our 4th wave of COVID-19. And again, the rate by which the numbers are going up is incredible. I made a point that in the previous surge, for us to go from a baseline level of patients and cases in our areas to a high similar to what we have right now, took us about 12, 13 weeks. It has only taken us 5 weeks to do that this time around. Less than about a month ago, in my system, we had a total of 11 COVID-19 patients. That number today is 111. So there's a 10-fold increase in the number of patients. It's just a matter of 5 weeks.
So, Dr. Porsa, we've heard that this is a pandemic now of the unvaccinated. How many of the cases inside your hospital are among vaccinated people?
That is probably the most important point that I would like to get across here. This is a pandemic of the unvaccinated. Look at my numbers this morning. Unfortunately, since January 1 of this year, my system has lost 128 people related to COVID-19 infections, 128 deaths across the Harris Health System due to COVID-19 infection. Not a single person that has lost their lives due to COVID was vaccinated, fully vaccinated. Not a single person. That's 0%.
Wow.
Sorry,
Doctor, what about the current hospitalizations? I mean, that tells the whole story, the number you just gave us. But right now, as we look at this Delta variant spreading in Texas and Florida and other places across the country, how many of your hospitalized patients are vaccinated?
Less than 2%. So 98%, more than 98% of the people who are currently hospitalized in a regular hospital bed or ICU are those who have not been vaccinated, more than 98%.
Dr. Ismail Porsa, President and CEO of Harris Health System in Texas, thanks so much for being with us.